Hello, and thank you so much for joining us at Hope TV, where you look and live. I am Sharon Naitore Wangenye, and today we're having a conversation around complementary feeding, infant and young child nutrition. And by the time a child is 6 months of age, they need something more than breast milk. And according to WHO, if complementary foods are not introduced around that age of 6 months or so, there could be growth. The growth could be faltered, yeah. Or if the wrong complementary foods are given, there could be growth faltering. So to help us with the discussion today, I have with me Dr. Washira. His name is John Washira. He's a pediatrician. And then I have with me Christine Gitau, who's a clinical nutritionist.
So my name is Christine Muturi Gitau. I am a nutritionist, dietitian. I have practiced for several years, and yes, I am a founder, managing consultant at Mviringo Wellness Consulting. And basically what I do is talk to people about foods and nutrition and what role that plays in improving your health and improving your personality and in general improving your life. And I'm so happy to be here.
Thank you for coming.
Thank
Can I tell you something?
Mm-hmm.
I wanted to be a nutritionist.
Oh my goodness, and then what happened?
Life happened.
I know, right? No, don't worry. I wanted to be a pediatrician.
Okay. Dr. will tell us what he wanted to be. Karibu Daktari.
Yeah, thank you so much.
Yourself.
Yes, I'm John Washira, a doctor for babies from when they are born, or probably even before they are born, all the way to when they transit to become adults.
Okay.
And I'm happy that we are discussing about food because that's all they do from before they are born to when they move. I just eat. I mean, all of us eat anyway. Yeah.
So
and
what did you want to become or to be when you were growing
you
up?
want the truth? Mm-hmm. A space scientist. I'm still following up what's happening in Mars and the Prova and the city that will be built there.
Actually, that's interesting. I follow Daktari on social media, and I know you want to be the first in space.
Yeah, we'll have that conversation very soon. When they start selling plots there, I'll buy the first one.
We will go.
That would be so interesting. Okay, yeah. Thank you so much for coming.
Yeah.
I'm pleased to have you and looking forward to this conversation. You started by saying, Dr. that food is all children do, yeah?
Yeah.
All of us. Food is all we do, and it's important to get it right.
Oh, yeah.
Yeah, so what is complementary feeding? Let's start there.
And maybe, okay, let me start just a step before that complementary feeds and say that babies from birth up to the time we are talking about 6 months, they feed for growth and development. And for the other activities, they're going to be undertaking. So by 6 months, the body needs more than the breastfeeding. So how do we agree that all babies should be breastfed, and up to the 6 months, exclusive breastfeeding? And the breastfeeding is the best diet. It's God's gift to human being because it changes as the baby grows from day one all the way to the 6 months, and it adapts the needs of that baby day by day, age by age. But by 6 months, the baby's needs they become more than what is now in the breast milk, and therefore we need to give some complementary feeds by 6 months.
Okay, so complementary feeding is therefore
and now we additional foods.
Yes.
You continue breastfeeding, but now you are adding other foods to meet the baby's needs.
All right.
Needs now for growth and development, and the activities now they're able to undertake.
Okay, let's start at that point.
Yes. 6
months of exclusive breastfeeding.
Yeah.
There's always so much word going around. People saying that if you don't have enough breast milk, you can just start at whatever age the baby is. What would you say concerning that?
The best we have to look at the best practices. What is all parents will do the best for their babies, and the best thing for all babies is exclusive breastfeeding, and the longer one can do it, the better. So up to the 6 months that we are talking about. If for any reason one cannot give the breast milk, then the formula milk becomes a distant second option.
Not water, not food,
no,
not cow milk.
Not food, yeah. And therefore, since breast milk is free, easily available, not being bought, right temperature, has everything the baby needs. There's absolutely no other reason why anyone should give anything else to that baby.
Okay. Why do we stick with breast milk?
That's a pretty good question.
And rather, if breast milk is not coming through, if I may put it that way, why do we go to formula milk as opposed to the rest of the things?
That's a very, very interesting question. And I'll start from the very, very beginning. So we advocate for exclusive breastfeeding, as Daktari said, for 6 months exclusively. No water, no medicine, unless prescribed by the pediatrician. So don't go prescribing tabia za wa mama, how let's talk on social media and then give your baby this, give your baby that. No. Even that, we say exclusively, not even water. So what breast milk has is that it has the water. It has all nutrients that the baby needs, all the types of fats that the baby needs, all the proteins that the baby needs, all vitamins, except vitamin D that we usually tell mothers, take the baby out in the sun. People should go out in the sun so that they get vitamin D. But aside from that, we have everything from breast milk. Now, what happens is now there are these things that surround breastfeeding that many mothers are not empowered to identify. And that is something that should happen even in the healthcare facility, even before you get your baby. We should have sat you down in the gynecologist's office when you were still expecting, during your antenatal clinic, and talked to you about breast milk. We should have told you things like, when milk comes in, this is how your breasts behave. This is how you know your baby is not getting enough. Because even that notion of enough.
What is enough?
What is enough?
How much is enough?
Exactly. I work with mothers who have just had their babies, and they say, hakuna maziwa, there's no milk. There's no milk at all. But then when I go to assess them as a professional, I look at it and this is milk. They're like, no, this is water. Someone once told me it is pus, the colostrum. Because we're not, at the very beginning, this conversation did not happen. So first of all, we need to support all mothers, even before the baby is born. Then is when we can tell them, this is what it looks like if your baby is not getting enough milk. This is what it looks like when there is a problem. And I'll finish this point at this point, that again, it's an issue of, was the mother supported, breastfeeding support. Once the baby came, were they taught how to position the baby properly, how to attach the baby properly to the breast? Because this plays a very big role in the, is it enough? Again, I use in quotes, because very, very, very few mothers will be unable to breastfeed if well supported.
All right.
Yes.
Thank you. Taking you back to what I had asked earlier, Daktari said you should be able to have breast milk till 6 months, I've had some mothers say, no, the formula milk is not good. I'd rather do cow milk. I'd rather do water. I'd rather do uji, porridge. So
I'll start from here again. I am an advocate of exclusive breastfeeding for the first 6 months, and then we continue breastfeeding for even more than 2 years, as long as the mother can. You can go as long as possible. Now, in instances where you have been assessed by your daktari, by your pediatrician, where there are health reasons, where the mother is sick, cannot breastfeed, is on medication, the baby has certain health conditions that prevent them from being able to properly digest breast milk. And you see, these are not things that the mother is assessing themselves. These are things that take a healthcare team to assess. So in that situation, then the mother usually is told to, maybe they can consider formula. If you consider anything else, it is not built for the baby. If you're taking cow milk, remember your baby is not a baby cow. So cow milk usually has very high levels of certain proteins that damage the baby's gut. You see, the baby's gut is very immature. Now this immature gut, you put cow milk in, it starts fast, it irritates the gut. Okay? As it irritates the gut, it just tears on it a little bit, a little bit, a little bit. So as it tears into the gut, what happens? Some particles of this protein get into the baby's bloodstream. And what do you get? My baby has a milk allergy. Where did it come from? Again, when you start introducing feeds that now are not tailored for the baby, again, this is even why breast milk is important. If you're introducing something that is not tailored for the baby, the risks of infection go up. As things like diarrhea, doctor will tell you how many respiratory tract infections, breathing difficulties that is hard to look at just because of those issues of early introduction. When you're introducing formula, now this is the disadvantages that come with it. Remember, you are not in charge of every single hygiene aspect in that when you're introducing formula milk. The water can get contaminated. The milk itself, because in the West, I don't remember which country, there was an issue with formula where formula was tainted with E. coli. That was a big deal. There are issues with bacteria. There are issues with hygiene. There are issues with now allergies and all that. There are issues with obesity. Because then, when you're introducing formula to the baby, it's not like breast milk. When the baby breast milk, they self-regulate. When they breastfeed, they self-regulate. When you are formula feeding, you put the milk in the bottle, expect the baby to finish. Come back later, you put it in another bottle, expect the baby to finish. So formula-fed babies, in the long run, not just when they're babies, in their later life, are at a higher risk of having obesity, of having diabetes, and all these lifestyle diseases. And notice I use the word risk.
Risk.
Because daktari can tell us more what that word means, but a lot of us say, si mimi nilifanya, I did it and my child turned out fine.
Yeah, daktari.
Yeah.
Yeah, actually I hear that so much. And in this day of social media, you just type up there, so moms, what can I? And you have 1,000,001 answers. Yeah.
Yeah, no, I fully agree with Christine. The exclusive breastfeeding is the best or the ideal way of feeding a baby. In the event that a mother has died, or a mother is in ICU or HDU, we do encounter that. Or a mother is on drugs for cancer, or a mother is on, has undergone surgery or something that, and there's a drug that cannot allow her to breastfeed, then they are offered formula milk.
Okay.
Yeah. The other foods will not meet the baby's needs at that time, so that's why you don't want to give anything else. Yeah. But exclusive breastfeeding, when it's not possible, then you go on to formula milk. Most of the formula milk, actually all of them, they are taken through a very stringent criteria for them to be registered where they are registered, and therefore they are safe. And countries out there, in the West, the Europe, all that, they of course within margins, within precautions that Christine highlighted about being conscious about the possible risks that might occur.
Okay. Well, still at that, what is the importance of exclusive breastfeeding then?
Exclusive breastfeeding is a whole book.
True.
Starting from once a mother delivers a baby, putting that baby on the breast allows the uterus to contract and stop bleeding.
Okay.
That's that's saving the mother's life. Second thing, and that goes on for the first few days. Most mothers, when they start breastfeeding the first week, they'll say they are feeling some more pain because that's helping them expel the clots that are there in the uterus.
Yeah.
And that's one advantage. The second thing is that the first milk that comes out is colostrum. That milk is loaded with defensive cells and protective factors for the babies to build up the baby's defense system. A lot of protein to help the baby to grow, and even lots of sort of laxative to help the baby to expel out the meconium and everything else that is in the system. That's the first 1 or 2 days. Then in terms of as we said earlier, it is a wholesome meal. It contains everything that the baby needs. The milk on day 1 is different from the milk on day 2 and 1 month and 2 months. It is just modified. God makes a factory in that breast that just pumps out milk that is adequate for this baby and that meets the baby's nutritional needs. Even when the mother puts a baby on the breast, the milk that comes out, the fore milk, is different from the milk that will come later, the hide milk. Yeah. So it is milk that is so well regulated that only that to meet that baby's need in terms of nutritional needs. Then, so we have talked about immunity. We have talked about nutritional needs. We have talked about talk about the brain development. There's certain factors that cannot be made in a factory, in a laboratory, that can only be found in a breast milk. So, and that helps the brain growth. You know, some of them, the nutrients for brain growth. Yeah, then talk about bonding. If you know, a baby, as a mother breastfeeds, then they start bonding emotionally, physically, socially, in all ways with this baby. Even if I mean, in all ways, yeah. So there's I'm sure Christine can add more. There's plenty of advantages or benefits of breastfeeding.
It's very true. I agree with everything Dr. is saying. And especially with, I will start from brain development. Again, you go on social media and then you find mothers, I didn't do that to my baby and they're fine.
Yeah.
Please remember, when we're talking about risk, what we mean is, if you walk through that road and it is dark, you might get robbed. Chances are you've walked through that road 3 times and you will not get robbed.
Yeah.
But one day you will get robbed, or somebody will get robbed. That's what we really talk about when we say risk. So when cognitive development, brain development now starts happening, just not even just as the baby is breastfeeding, but even before that. So what the mother was eating when she was pregnant, and after that, now what she's doing when she has given birth, and what she's putting into her body, how rich, how healthful, how what we say strong. You know, you hear people saying, my milk is very strong.
Yeah.
So those things, when the brain development is happening, children who are breastfed, when studies were done, had better scores even in school that went beyond the earlier years. Again, when the baby is being breastfed, remember, when you touch a baby, even babies who are in the preterm babies who are in the NICU, NICU, in the nursery, what are mothers told? Carry your baby. Put the baby, you call it kangaroo care, carry your baby. Because babies who are touched, they grow better than babies who are not touched. That's something we should all remember. So breastfeeding provides this opportunity to touch your baby, to be close to your baby. That aside now from the fact that you're giving them food, because you can give them that food in the bottle, but you don't touch them. And this still affects their brain development. Their social skills will grow from how are you speaking to them when you're breastfeeding, you know? You're wondering, why is this baby usually so bitter? But you were very bitter when you were touching them as a toddler. So all these things come into play.
All right.
Now, Dr. mentioned the fact that breast milk is free. Remember, it is also clean. Okay? You don't have to wash anything. Maybe just make sure you maintain good hygiene. So you're sure that this is safe. Okay?
All right.
It is timely. What happens if you run out of formula in the middle of the night? So the
baby is yelling.
And the baby is yelling. It's timely.
Yeah.
So breast milk is adequate. It is safe, very safe for the baby. It is feasible, meaning that there is very little risk that now you will run out of money for breast milk. You will always have your breast milk. It is affordable, it is feasible, it is safe.
All right. Okay.
Yeah.
Okay. Doctor, tell me about the nutrition of the mother while expectant and while lactating.
Okay, talking about mothers, you're talking about a mother who is going to carry a baby in her body, in the womb.
Yes.
And therefore, her body should be well prepared before that. Ideally, they should do preconception counseling. Sit down with a dietitian and see, how am I healthy? Do I have enough iron levels? Do I have anemia? Do I have other nutrient deficiencies? And then correct that before they become pregnancy. Because mothers who become pregnant when they have low levels of folate, they have problems with it. Some babies get brain problems. Others get spinal deformities because of that lack of folate. And that's why they'll be given supplements in the early pregnancy with folate. So ideally they should be eating well, eating healthy, do a checkup before they conceive. That's, and then they become pregnant. during the pregnancy, again, they should work with a dietitian and look at what food is meeting all my needs, a balanced diet in all ways. And in specifically because they have a baby that's growing in them that has got bones and blood that's growing, they have need for extra calcium, extra iron. Again, if they don't do that, again, in the pregnancy, in the antenatal clinics, most mothers are given supplements. I won't mention the commercial names, but many of them will be having calcium or iron. Others, there will be other nutrients added in there. But all of that is to meet the mother's needs and the extra needs to help the baby grow. So that is during the pregnancy. Then as they go on to delivery, now they need more. Remember, this mother is going to lose blood, whether they deliver cesarean or they deliver normally. So again, they need to eat healthy, eat well, to have enough iron levels to maintain the normal hemoglobin level or the normal amount of blood in their system. And then as the baby is delivered, again, they're losing blood also in that placenta and all that goes out. So they need to have eaten well, eat healthy, and that's why you find most communities, there will be those first 2 months when the mother should just sit down and be taken care of. She feeds well to recover from all the losses of the blood and many other things she has lost during the pregnancy and during the delivery. So she should sit down and eat well. During this, as she starts her journey on breastfeeding, and then she should be very keen on feeding healthy. Again, a balanced diet, regardless of which community they come from. Different communities will promote different food that they think in their community is more nutritious. Again, that is, that the main point is they should be having a well balanced diet throughout the breastfeeding period, with an eye on calcium. What will give them enough calcium, because breast milk is loaded with calcium, so they're losing a lot of calcium. And when they don't feed well, within the first few months, you'll hear a mother saying they are feeling teeth sensitivity, their bones are feeling painful, they are having back pains, and other signs of low calcium in their body system. Others may even have low iron levels, so they should be able to feed well with foods that have got rich in those nutrients. And where they can't get those foods, or where they already have low levels, they should be able to take supplements to to top up those nutrients that they have. That is how that's briefly how they should look at it. And then as they go on, the first 6 months are key, because the baby is relying on this mother 100%. And all communities know mothers should take a lot of fluids, take a lot of different feeds, which is very important. Again, feeding is culturally defined, but what is important is they should have an eye on all those food items that we have, those food groups that we talk about, whether it is the carbohydrates, the vegetables, the proteins, the fats, all that. They should be able to eat a well-balanced diet in the course of the day, not necessarily in the same plate, but in the course of the day they should have eaten their fruits, eaten their vegetables, their starch, their plant or animal protein, depending on their culture that they are in, and that topped up with plenty of fluids, again depending on which community they are coming in. Things to think about during the pregnancy and diet is before conception, again, they should avoid anything that can harm the baby. Smoking and alcohol, they are no if one is preparing for pregnancy, because they have potential risk to the baby and to the mother. Even during pregnancy, there are babies who can be born with deformities and abnormalities because the mother took alcohol or was smoking. And even during breastfeeding, the mother should avoid the alcohol, the smoking, because it also has harmful effect on them and the baby. Yeah.
Is it true, Kristen, that whatever you're taking in as a lactating mother is what is directly going to the baby?
That's something that we should all be very keen about. Yes. There's some, even when you're taking medication. Remember, when you go to the doctor and you're breastfeeding or you're pregnant, first thing they ask you, are you pregnant? Are you breastfeeding? Because there are some drugs that when you take them, they go straight into your baby. There are some drugs that when you take them and your baby breastfeed, the whatever has come into the breast milk, they're going to have side effects from those drugs. Yeah. So this is just medicine. So imagine when it comes to all these other casual things that we do. There are growing trends, again, social media, oh my goodness. When you go into social media, you find a lot of women saying, one bottle is not bad. But no, it's very important not to take alcohol when you're pregnant, because the risks to the baby are higher. They are much, much higher than any other time. when you're pregnant and when you're breastfeeding, everything that you put in. Now, again, what Daktari was talking about, a well-balanced diet, a healthy diet that has all the carbohydrates, has some protein, has some vitamin sources. Now, depending on your culture, and then make sure that you vary them. Okay, so sometimes you find in some cultures, I will not say which ones, we usually get just one. We are
Porridge.
told porridge and
Black beans.
yes, you win. Yes, because you're told these ones are the ones for you in this situation. But it's very, very important that you have a variety. Have a variety of what is available to you. Again, we're not talking about what is special, special in terms of, oh my, from today all you eat is cauliflower and broccoli, and for fruits you're eating strawberries. No. All we're saying is look at what is around you. If what you have is cabbage and spinach and sukuma wiki and all that, today have cabbage. Tomorrow have sukuma wiki. Don't say I was told sukuma wiki is the only one and then stick to it. Because that promotes, that variety promotes nutrients. And if you're eating a meal that is full of nutrients, this is what you're giving to your child.
All right.
Those nutrients.
Okay.
Again, it's very important to think about these issues that now surround pregnancy and weight gain. Because a lot of women feel, I shouldn't gain so much weight. I need to snap back.
Yeah.
The societal pressure to snap back is a lot. Everybody wants to, we want to look a certain way. We want to fit the social media profile. We are not promoting weight gain to the point that now you cannot walk because of how much weight you've gained. But what we're saying is during your pregnancy, you should gain at least 13 to 15 kilos. You see? We're looking at around that area.
Not too much.
No. I'm not going to go into the too much area.
Okay.
But what we're saying is, this is not the time to put yourself on a diet. We have an issue with women, as Daktari mentioned, teeth sensitivity. So you wake up in the morning, oh, my teeth. Oh, every time I get pregnant, I have to lose a tooth. We've had
it should not happen.
It
right?
should not be happening.
Every
time I get pregnant, my teeth are sensitive. I usually, using the word usually and a disease in the same sentence is not normal. I usually have anemia. That means you should have attended your antenatal clinics. This is why precisely we go for ANC, antenatal clinics, the clinic before you get your baby. Then the other reason we go for the clinic before you get your baby, because now we are at the pre-part, that we go into the post-part, is every mother needs to be tested for HIV. Okay? Why? Because when you tested for HIV, the chances that you will transmit it to your baby, if intervention is done at that point, immediately, when you are pregnant, immediately they are reduced. The chances are so low that now you will have a beautiful, healthy baby that you can even breastfeed for as long as you want to, within guidelines. Now you're given those guidelines during that time. So it's very important to go for your antenatal clinic, because now this part, you're not starting to feed your baby before, just when they're born. Now when you put them at the breast, you see now they've started eating. You're starting to feed your baby from that time. Then they come.
All right.
Yes.
What about the question of, I know you said you don't want to go into too much, but I'm thinking the health of the mother is also important after they have given birth, while lactating, and there's this cultural dynamics that we have around, and these people say you should eat a lot of X and Y and Z, and some people, if I would put it so, tend to add a lot of weight that then, I don't know, becomes an issue to them.
Let's start from here. Any breastfeeding mother should be taking at least 500 calories extra. So what does this translate to? When you're breastfeeding, when you're pregnant, you're taking, we start with pregnant mommy, 3 main meals, breakfast, lunch, dinner, 2 snacks, and 1 small extra meal. Make sense? Now you start breastfeeding. When you're breastfeeding, imagine you're giving food literally to somebody else.
Yeah.
So you take 1, 2, 3 extra meals. Oh, sorry, 1, 2, 3 main meals, 2 snacks, okay, and then 2 small extra meals. All right. So let's start from there. Now the challenge that we get is the what. Is not the how much, is the what. Because then we start, I was told to eat, and then throw caution to the wind, and you sit down with a big bag of chips.
Yeah.
You see, that's it. It's not the issue of the how much. Mostly it's
what.
the issue of the what. What have you been eating? When you're eating food that is very high in starches, high in carbohydrates, and then very low in vegetables. 1 teaspoon, like we do a vegetable garnish.
Yeah.
You're not taking in as much nutrients as you should be.
Yeah.
That plate should be having more vegetables. That's where we start at.
Okay.
Then again, we now need to alleviate these pressures that come with motherhood. Somebody is a mother. When you have a baby, so much changes. So many things change, and Daktari can attest to this. Even your character, even your very being changes. And it's very unfair to have the expectation that that change did not affect your body. It's very unfair. All we do is encourage the mother to adopt healthy habits. As soon as they can take light walks, because when you walk and you do a little bit of exercise, it even helps with the breast milk, because now you're more relaxed. When you're more relaxed, you have more milk. When you exercise, those endorphins make you feel good. You feel good about yourself. You're confident. When you're confident, you have more milk. These are things that help.
Yeah.
If you are a bit scared and withdrawn and not confident in your ability to feed your baby, then chances are you will not be able to feed your baby. It has a lot to do with what you feel up here.
Right.
So let us provide support to moms, even as they have their children, and encourage them to have a good, healthy lifestyle and provide a safe environment for them.
All right.
Yes.
Okay, thank you. Just to remind you that you can get in touch with us, drop in a comment or a question on the number that appears on your screen, and our guests will be able to answer them. Daktari, back to you on the issue of nutrition, good nutrition in a child's health. You said you work with them from just before they're born all the way till they're 17, or is it 18, 17 or so? What is the importance, or what role does good nutrition play in a child's health?
You're literally what you eat.
Okay, so it's not just a saying.
Yes, no, you're literally what you eat. I mean, if you take that child at birth, they are like 2 kilos, 2.5, 3 kilos, or 4 kilos, anything between 2 and 4 kilos. That child should be going to the clinic and getting a weight taken every month, and should be gaining some weight, and should be doubling their weight anywhere between 5 and 6 months, and should be tripling in somewhere around 9, or should be going to about 10 kilos by 1 year. So if you take that as a rough guide, that means this child should be feeding enough to gain weight, and the weight is a good marker of all the organs that are growing, because you cannot do a scan and see whether the kidneys are growing, the liver is growing, the brain is growing. You just take the weight. The weight helps to know that all the organs are growing normally. As long as you have a good weight gain, and all mothers are familiar with the vaccine, with the well baby card that has got a graph there, every child should follow their own graph from where they started. There are lines drawn by World Health Organization, the government of Kenya, on that map, and whichever clinic you go to, they have very nice graphs there, and the baby should follow that graph as a marker of good growth. So, and therefore, this baby should be getting, for those who are breastfeeding exclusively, they should be breastfeeding enough. That means they should be, sitting with someone, tell them, how long do you breastfeed? From birth, around 30 minutes or longer on one breast, so that they get all the way to the high milk. Then as they move on now towards, towards as they get bigger, they'll feed on demand. because the body has got its own reflexes of knowing when they need more, and therefore most babies just wake up to feed. Others can sleep a whole night by when they hit about 3 months or thereabouts, they can sleep a whole night because they breastfed enough. But when they lash on that breast, they'll be feeding for the whole night. They'll pull enough milk to last them a whole night. So they feed on demand, so they can control how much they'll need. So the mother's role is to feed well, so they have enough milk for the baby to get what they need. Then now, as you get 6 months, then the baby's needs are more than what can be met by the breast milk. And that's now where the mothers or the parents should sit down and discuss with a dietitian, with a pediatrician, with the nurse at the clinic, or whoever else is helping them, because they are all attending different clinics, and sit down and see how do they meet the needs for the baby. And it's a simple thing as what everyone learns about the different food types. So the baby should be fed on all those varieties, the starch, the vegetables, the proteins, so that they can be, of course, the fruit, so that they can be able to meet their needs for them to continue growing. And even after beyond the 14 weeks vaccine, babies should continue going to the clinic for the first 2 years. At least our government of Kenya can provide up to 5 years. They should be going to the clinic at least for the first 2 years every month and have their weight taken, and that way the parents will be knowing if the baby is growing well. Yeah.
Okay. When we come to complementary feeding, the big question is, what do I start with?
Okay. I know Christine is very good with menus. I'll get back to her.
Okay.
But she's very practical. Let me just mention that the basic principles is that this baby is moving from breast milk to solid foods. And I want you to walk with me to different communities and different villages in this town, different corners of this town.
Yes.
So all mothers should be able to provide on their table a food that is well balanced for that baby to take.
Okay.
And to start with, they'll start off, you're worried about things like digestion. This baby cannot breastfeed, cannot digest nyama choma at 6 months. So you want to avoid what the baby cannot digest.
Yes.
You also want to avoid those strong flavors, the spices and things like that. We want to put some things aside and concentrate on what is good for this baby. And what you find in the shops, in the supermarket, in the homes is most communities have a winning diet. Some people go on for porridge, others go for and that's fine. They start with the porridge, as long as they don't stick on the porridge, because porridge is just carbohydrates alone.
Yeah.
They can do it for even a week. Then they introduce something else. Let me put it this way: that looking at I've sat in different forums in different countries on matters about children, and what you find is that they'll all think the same. That you want to start with something simple like porridge, all baby cereals, all that pumpkin, all that potato, all that matoke. But you start with one item that can be made soft and thick, like thick paste. You give that baby. Then after a few days, some people do 2 days or 3 days, others even 5 weeks. Then introduce something new. The point is, every week you introduce something new to make the food rich enough to meet the baby's nutritional needs. And roughly by the first 1 month, you have already introduced all the varieties of you have a starch, you have a vegetable, you have a protein, and you even have vegetable. We even have fruit in that diet, so that the baby is getting the normal nutritional feed. Again, you are looking at good routines. So Christine mentioned about the 3 main meals. You have a breakfast, you have a lunch, you have a dinner. So this child should also have a routine. They have a meal in the morning, they have a meal in the midday, they have a meal in the evening, and then they have snacks in between. So initially, most of those snacks will be breastfeeding. The baby takes a meal, a feed in the morning, then breastfeed some later in the morning. Then takes a meal around midday, then breastfeeds much of the afternoon. Then takes another meal in the evening, then breastfeed much of the night. So that's at the first month. As they go on, then you find the baby needs more, and those snacks will be replaced now with solid foods again. You'll find that now the baby is getting some fruit somewhere in between, where they would actually be breastfeeding, and now what they'll be doing, they'll be taking the fruit, and then maybe an hour later they breastfeed. You know, so there is like a dessert for them. So they're taking out the breastfeeding to add on the food that they are taking. So those are the varieties. You have got one. You start with a food that is simple to digest, simple to make, and simple to give. And again, you also want to avoid constipation, because if you start with a complex food, they are likely to give digestive problems. So that is on the food types. Then how to introduce? You introduce the foods progressively. You don't give the baby 3 different things on day 1. You want to give one type over a week as you observe for any reactions. Is the baby digesting well? Is there a problem with constipation or rashes or diarrhea with that food? Then the routine we have talked about. You have got timing for the feed. Food is cultural, has a cultural value, and the child should eat the way you eat in your home. And that has many implications. One of them is in our part of the world, we take a breakfast, a lunch, and dinner, so that child will be taking that plus the snacks, mid-morning and mid-afternoon. But also in every family, there is what you take in your family. Is what you don't take in your family. Many times you don't take what you have, you avoid what you are allergic to. Yeah. So, and that child might have a risk of the same allergies. So you avoid food that you don't take in your families many times, but not at the point of risking malnutrition for your baby. I mean things like, if you have allergies to certain proteins or certain food stuff, then you can avoid that during the first year when you are introducing your baby to the feed. You can test them thereafter, in issues of allergies. Yeah.
All right. Our menu person.
Oh my goodness, I have a story. Tell us
the story.
Story.
Story comes.
So here we are in our African setting. True?
Yes.
And in some communities, I was actually telling Dr. about this as we were starting. In certain communities, you hear people saying, we need to cut the baby's first hair, the first hair, the one they're born with, because it prevents them from growing. And then, after that, you see it even turns red and falls off. That's how you know. After it falls off, the baby starts growing.
Okay.
I know there are people who are listening to us and might have had that. But can I tell you something? The conclusion of the story.
Yes.
Most of the time is because, especially protein foods, were delayed in this child.
Oh.
So this child
Now
was getting some protein deficiency, but then we are attributing it to the first hair. So later, because a lot of people, we want to introduce, by the time the baby is finishing the first 6 months, at least they have had some plant protein. True? By the 7th month, you're starting to introduce some animal protein. Because then, if you delay this longer, the chances that this child will develop a deficiency is really, really high. And then when they develop a deficiency, then instead of it clicking, oh my goodness, my child has a deficiency, you go, you see?
It's the hair.
It's the hair. So it's very important we look at it from that perspective. Okay. Introduce, as Dr. said, make sure that you're not delaying introduction of certain foods in favor of, especially staples. In some communities, we tend to introduce a lot of potatoes and pumpkin, and forgo the beans and the bread, and then the beans and the kamande and the meats, we forgo them. The other thing we're looking at is, imagine this child is going to develop tastes and preferences based on what you're introducing. True? So make sure that, yes, as Dr. is talking about allergies, make sure you do not also introduce your biases to your child.
Okay.
We have tendencies, I know we do this even with relationships. We've seen these memes going around about introducing our grudges to our children, and they know nothing about them. There's a story I really, really enjoy about it. I know you've heard it so many times, but it is one of my favorite stories because it illustrates the cultural value of food and the familial practice. So you start with the family, and this person got married. When they were growing up, they noticed their mother used to cut fish, put it in the pan, and then cook it. So the husband had never seen that. No. the husband goes, hey, why do you cut this fish? The lady says, I don't know. My mother used to do this. So later she goes, asks the mother, so why do you usually cut your fish before you put it in the pan? Then the mother went, I used to have small pans.
Ah.
I used to have small pans. So my fish wouldn't fit, and that's why I used to cut it. So we see, we have this tendency of introducing our biases. In some communities, we don't like fish, and in some communities, they don't like beans. But do not introduce your biases to your child. Make the menu as varied as possible. Okay?
Okay.
The other thing that Dr. really mentioned was about the texture, and he really emphasized, and he said, make sure it's a thick paste.
Thick paste.
Thick paste. This is very important because we find children who are 3 or 4 and cannot swallow rice. There's an issue.
Yeah.
Okay? The other thing that I think I'm going to take us back a little, I will take us back a little bit from the behind, is you find now, a lot of moms, when you're talking about growth, you say, as long as the baby is gaining, even if it's 100 grams, no. Dr. really talked about the baby should be doubling their weight within the first 5 to 6 months, and then tripling it by 1 year. Tripling it. Like if you were born at 3, you need to be at least 9. You see, what he is saying is, if your baby is not gaining weight, it means something in them is not growing. So we need to get rid of this notion. As long as you're doing your best, okay, fine, I know you're doing your best, but it's important to seek help.
Okay.
And I do want to acknowledge that as health workers, sometimes we are not we might not be very welcoming. And a lot of women especially have this fear, especially after vaccination. You don't want to go for growth monitoring because you feel judged. Don't feel judged. We are here to help. That's something that we need to look at.
Yeah.
The other thing that I really want to talk about is the habits surrounding food. As Dr. mentioned, the schedule. Yes, some of us, we will put the baby on the schedule and we'll say, this is how we eat. But then we hide the baby at the back. We take them to their room and shove food in their mouth. And then wonder, why doesn't this baby like food? It's important that we make food a social habit, because eating is a social habit. How do you feel when you're eating and people are shouting? How do you feel when you're shoved into a corner to eat alone? If you attend an event and you are the only one eating, how do you feel? You don't like it. How do you feel when people around you are seemingly enjoying and you're struggling? Okay? Again, how do you feel when people try to shove food in your mouth and you know you're full? I know all of us have, especially as grown-ups, there's a running joke on when you visit your grandmother and you come back.
You come back.
For those ones who are lucky to have their grandmothers with them, you know how you feel full. You love it because you know it's love, but then it's not a very comfortable feeling. Remember, these are things that we're instilling into our children. So first, trust that your baby has the ability to self-regulate. For starters, we find a lot of women coming in and saying, my baby is not eating enough. There is an issue. I asked for this cup.
Okay. I want you to hold on to that cup because we need to take a break. We need to take a very quick break. We'll be right back. Remember to get in touch with us through the SMS line, and later on, hopefully we'll be taking some of your calls. Please stay with us. Welcome back, and thank you so much for staying with us. If you joined us, Karibu Sana, we're having a conversation around complementary feeding and nutrition for infants and young children. And my director is saying, alinyonya sana. Yeah, he feels like his akili yake ilitoka kwa hiyo kunyonya.
Ni kweli.
We appreciate you. Thank you so much. Remember to send us your question on 22232. And the doctor we have here, who is Dr. Wachira, who's a pediatrician, and dietitian Christian, who will be able to help us with that. Welcome back.
Thank you so much for having us.
We left it at the point of the cup. What was the cup about?
This is very interesting because this cup is everything. Okay, this is a 250 ml cup. So when we start feeding a baby, we don't even feed them a whole cup. You know, all of us usually get that big thermos cup, you know, and then you put uji inside.
Yeah, the black one.
Yes, the black one or the green one. You know, the biggest.
Maroon.
Yes, the biggest thermo cup that you have. That's what we usually look for, and then we say, hey, Toto, the baby has to finish this. And then we say, my baby doesn't have good appetite. They don't finish.
Yeah.
But how much should a baby be taking? So ideally, when they're starting, we start at 2 spoons, like the first time. We give 2 meals in the morning and in the evening, 2 spoons, 2 tablespoons.
2 spoons.
2 spoons.
Wow.
If they want more, you can give more. Now, this is what we call responsive feeding. You feed the baby according to how much they want.
Okay.
Again, remember, we are building habits. Why do you think that a lot of us have issues with stopping when we are full? Because this is a seed that was planted. So you take the lead of the baby. At maximum, you give 2 spoons. Observe. If they want more, give them more. The second, third week, now between week 3 and 4, you're giving them 3 spoons. Between the 7th and 8th month, you're giving like half a cup. And the reason I got this cup is because it's half of this cup. This is a 250 ml cup, not half of the big thermo cup. Not a full thermo cup. Because we find a lot of parents coming in saying our baby doesn't have appetite, but you're giving them the big thermo cup.
It's too much for them.
It's too much for them. Remember, overweight and obesity in young children is a pandemic. We're having a lot of children with diabetes, babies with diabetes, with type 2 diabetes, the one that we call lifestyle-related diabetes. That one, we're getting it in children, very young children. We're getting very young children with fatty liver related to obesity. Okay, that's why this is the visitor cup, modeling a cup. This is the visitor's cup. When we have guests, this is the one we use.
Yeah.
So I said at around 7 to 8 months, they're taking half, but then respond to what the baby wants. So you're giving half a cup. By the first year, by now the time they're 1, they're taking a full cup. Okay. By the time they're 2, they're taking 1.5 cups in a meal. So you see, it's very progressive. We didn't start at the 1.5.
Yeah.
So it's really, really, really important that we note that.
So it's not a question of how much, it's a question of what.
Yes. No.
Yeah.
Yes, it's not how. No. Yes, it's how much and what. Because now these things that we do to children, Dr. was telling us about children who are force-fed, and we are losing a lot of babies because of aspiration.
Yeah, you hold them up and
shove the uji
down the throat.
Trust. And also, remember, we are not creating happy environments when it is mealtime. The child is unhappy, tired. This is now, there's a question of how do I build my baby's appetite? This is how. This is just how. It's not even about giving them supplements. I don't know what multivitamins. It's about what environments that you're creating around food. If the environment you're creating around food is dreary and scary and nasty, you do not expect that this child will want to eat. That's one. If sit down with the child, make sure the child is upright, make sure everybody is participating in their meals. By the time this child is 9 months old, they should be eating what you're eating. So we have a lot of people coming in and saying, my child refuses to eat their own food. What multivitamins should I give them? Give them what you're eating. Why do they want to eat your chapati but will not eat their mashed whatever? Give them what you're eating. Because then that's how they get curious. That's how they learn. If you had to have everything blended in a blended mash every single time, would you have appetite?
No.
No, you wouldn't.
And actually, speaking of blending, Kristen and Dr. you were talking about the consistency of the food and the fact that we should not be doing all this sieving and blending that we do. I'm a victim. I sieved and I sieved all the nutrients, and my baby had a lot of constipation.
Yeah.
Imagine.
Yeah, okay. It's just a way of saying introduce your baby to the family diet as is possible. By 9 months, baby should be feeding your normal food that you're eating in your on your plate. Even if you start with sieving, with bleeding, with all that, but you should be quickly move over to the mashed food and food that everybody else can eat. But look at the consistency. It should be thick enough not to fall off. It's not pouring off from your spoon. It should actually be sticking on that spoon when you're feeding the baby. That's how it should be. Yeah, but again, talk about safety. When you're feeding the baby should be upright, preferably on a high chair or one of those. Even a normal sofa set or any seat where the baby is should be seated upright and with the back supported. Then make it fun that you are all feeding. You're feeding the baby. No TV, no video games, no phones.
Phones, video games.
Yeah, because that's distraction. Food is an enjoyment. It's made for enjoyment. Actually, I mean, when Jesus wanted to treat his people, he actually told to give them a nice, beautiful meal. And in most cultures, a feast is meant to be celebration. And eating time is feasting time. Food should be you should put your food in your mouth, enjoy the taste of that food. So babies should be allowed to do that. Not pouring the food in the mouth. Baby has no idea what they are eating. They should be able to tell, today I'm eating carrot, or I'm eating broccoli, or I'm eating this other food. They should be having nice, well-made food, and then in a good environment where they are all feeding. Not that baby's feeding time, just pour the food in the baby's mouth. No, it should be eating like everyone else, and allow the baby to eat slowly and swallow the food. And also observe the baby, because we all have different tastes. There are babies who don't like this food, so you try to mix. You'll know the baby's taste as long as you balance that they have. There's a vegetable, a protein, and a starch in that food. Not 3 starches and a vegetable. I'm not talking some communities.
Yes.
But I'm just saying one starch.
We know ourselves. It's okay.
That's really important. And remember, when we talk about micronutrient deficiencies, when you say micronutrients, madini, the vitamins and minerals, madini. I was told by a Swahili speaking friend that vitamins is viburotisho. I have not gotten it, but still.
I don't know.
So, vitamins and minerals are important. Introduce animal foods. By the time the baby is 7 months, start introducing some fish, and not supu ya samaki. Tafadhali. A lot of people say, I give my baby fish, but you're giving them fish soup or beef soup. It's not the same. It's not the same at all. If you have to, if you can offer minced meats, like make up nice patty, a burger patty or a small meatball or something, but do not give the baby soup and say you've given the baby meat. That's very important.
All right. At this point, let's talk about malnutrition in children, Dr.
Malnutrition occurs when children don't get what they need. And
the madini and the rest.
Basically that. And the sad news is that studies done in Africa, in Kenya, every time when Kenya does the Kenya demographic health survey every 5 years, we actually find most of our children have a lower height than they should be having, and are thinner than they should be having in general population. Of course, nowadays we have a small number that is overweight, but many children, even among those who are overweight, they are lacking minerals and vitamins, and commonest even things like iron. The hemoglobin levels are usually lower, and worst case scenario is now where they are lacking proteins. Let me start with the traditional kwashiorkor or marasmus, where the babies they have acute malnutrition because they are lacking some protein, some calories, all that. So that usually occurs when in setups where babies are only given one type of food. Pumpkins, baby is just being fed on pumpkin every month. That baby is malnourished. Will become malnourished, and so to prevent that, there should be a starch, a vegetable, and a protein, and a different one per day past the age of 7 months. So that baby should be having a different starch, a different vegetable, a different protein per day. And by that, for the communities where they eat meat, animal proteins. They should be changing even the varieties of animal proteins. So they're having the red meat and the white meat, and even the fish as it is in that group. That's mainly for the proteins. The other group is the group that misses that get malnourished with now the things like iron deficiency. Iron deficiency mainly occurs when babies are just fed on cow milk too early because it interferes with the process of absorbing iron. Babies who are given milk and milk and milk and milk, they are likely to have low levels of iron. So these babies should have milk that is given on stated times in the day. What you find is that babies are just given milk anytime in the course of the day. After they have eaten, they are given milk. Then the mother complains that my baby is not feeding because I'm full with the milk. So in that group, one should be keen on giving a balanced diet. For the breakfast, for the lunch, for the dinner. But it's 2 or 3 meals in a day should be well balanced with the vegetables. Green vegetables are good, in terms of part of the blood building, and as well as now the animal proteins, as well as the legume, the legumes that we talked about. All those should be in that diet. So iron is one of the other thing. The other group that the other malnutrition we normally find in our settings is rickets, low vitamin D, or leading to low calcium. These are babies who are not put out in the sun early because they live in a flat or they live in a cold area, and the parents don't want to go out in the weedy morning, so they don't go out into the sun. They get rickets. So, and also others because they don't get the milk. They get food. They get different types of food, and maybe they're not breastfed enough. So babies should be breastfed well enough. They should be put out in the sun from the first, or after the second week or the first week, should be getting the latter minutes of sun exposure. So that will reduce the risk of the rickets. And again, as they grow on, the varieties of food we talk about, including animal protein, because fish is rich in the vitamin D and the calcium we have talked about. And then the other group of malnutrition is now the micronutrients. I won't mention them, I won't mention the actual names of the minerals and the vitamins, but babies can have low levels of any of those minerals and vitamins, and many of them are found in vegetables.
Yes.
And many of them are found in when babies are only fed in high calorie diet, in the fast foods, when they're given a lot of ugali, a lot of rice, a lot of chips, a lot of potatoes, a lot of matoke, then they miss the vegetables and the proteins. So they should be having a lot of vegetables. I almost like a third of that plate should be different vegetables. Vegetables is not greens. It's not just green. There should be different colors on that plate. There should be different colors on that plate. That kitchen garden should have some carrots, some broccoli, some cauliflower, or something else that is not necessarily green. Yeah. Green is good, but should not be the only vegetable that is on that food. Okay. So that way you'll address the micronutrients. Then most important, fruits. Yes. Babies should be introduced to fruits in the those first 3 weeks of weaning. Those first 4 weeks of weaning, one of the weeks should introduce fruits, and then start introducing different fruits day by day. The issue is not trying to think which fruit is rich in what. The point is you don't have to know what they contain. Just to give a different fruit every day. Same thing with vegetables. Don't try to think is pumpkin a vegetable, is peas a vegetable. No, that doesn't make. It's not that your baby doesn't. What your baby needs is a different food item per day. Exactly. That way they get all the minerals and the vegetables they need. And fruits, they should have the fruit every day from that time and the rest of their life. They should be having a fruit every day or different fruits every day. So that will meet most of the other nutritional needs.
Are there long-term repercussions for malnutrition?
Yeah, we talk about the golden 1,000, the first 1,000 days being a golden window of opportunity. You're literally what you ate in your first 1,000 days.
Oh, wow.
Yes. The brain, the head circumference increases in the biggest way in the first year of life, and in the biggest way in the first 6 months of life, the biggest way in the first 3 months of life. The head circumference is like 35, 36 at birth, and is about 10 centimeters more in the first in the first year of life, let me say. So, and that is a measure of how much the brain has grown. So children who are not fed well, their brain will not grow in size. And the other organs will not grow optimally well. So babies, all of us should focus keenly on those first 6 months, breastfeed exclusively, then start complementary weaning, be intentional in having balanced diet, because all the organs are growing. And the first year, that brain, the IQ and everything else will be acquired as per what one fed. And all the other organs, including the bones and the pelvis. Let me just say girls who don't feed well, you find their pelvis being smaller. And even when they come to giving birth, they can't push a baby through that. Yeah, because of because they didn't get a good size, and that also goes for men, but the men may not have an obvious effect. Yeah, and that goes on the whole body system. It forms the optimal period of forming in the first year of life, and we should be fairly intentional in terms of how children feed from birth and in the first few years of life, and also that also forms habit of how they will be feeding thereafter.
All right. Wow, our time is very well spent. We have to take a few questions, and we start off with this one who says, my baby is 5 months old, does not breastfeed but takes cow milk. What do I do? Is it a risk, Daktari?
Yes, a risk, because the cow milk is not well digested at that time, and the mother should look at how she can increase her milk production, her breast milk production. Eat well, drink well, go to the health center where they go for clinic, talk to the people there, talk to the health workers there, and see how she can increase her breast milk. Worst case scenario, she can even start weaning, at that time mother just giving cow milk alone if she completely has no milk, and she can't even afford the formula milk. So this mother should be supported to breastfeed, get enough milk, and then look at other options if she doesn't have enough breast milk.
Okay. All right. How do I make my baby eat vegetables?
Wow.
She doesn't like them at all.
Do you like your vegetables? What
question.
is your face when you're eating your vegetables? You notice babies want to eat what you eat. So you cannot say, these vegetables are yuck, I don't like vegetables, and you expect that your baby will eat vegetables. Do as you do. Let them do as you do. So the first thing you have to do as a parent is ensure that even when you yourself are eating those vegetables, enjoy them. Okay? And it's not just the greens, carrots. When the baby is playing around the house, as a snack, have some carrot sticks lying around. Those are vegetables that Daktari was saying.
And
vegetables
tomatoes.
are not green. They're all colors. Have those lying around. Eat them with as much gusto as you would your favorite food. And you will notice your baby following along. And before you know it, that's a habit that you both will share. You'll be wondering, how come my baby, you'll be telling people, my baby and I enjoy vegetables together. Yes.
Okay. There you go, ma'am. This one says, please help me know what to feed my 1-year-old daughter and how many times so as she adds weight.
That's a very good question. So by the time the baby is 1, they should be eating the 3 main meals. They shouldn't be having the 2 snacks. Okay. And now you're eating between 1 and 1.5 cups of food. Now that's how you check if your baby is eating and eating enough. Again, look at things like water. Make sure if your baby is still breastfeeding, they encourage breastfeeding and give maybe a cup or 2 of water throughout. Just spread it out in the day. The other thing that you want to make sure you do, as Daktari really mentioned, is make sure you take the baby to have them weighed. How will you know they're growing if you don't have them weighed? And remember, them growing too much, like when a baby is extremely big, I know we want those big babies with big rolls, but if your baby is very big with big rolls, and when you mark their growth chart is red upwards. You know, there's red downwards and red upwards. If their growth chart is red upwards, that's still a problem. That's something that we should be looking at. Take them to get assessed.
All right.
Yes.
Okay, the question of water. We said 0 water during the 6 months of
exclusive breastfeeding. No water.
No water.
No water.
No water.
No
The
water.
baby is not thirsty.
The breast
no water.
milk, do not feel thirsty on behalf of your baby. I know there's something I should mention here. How do you know your baby is getting enough breast milk? Number 1, A baby who is getting enough breast milk will gain weight. At least, and this is the minimum, at least 500 grams every month, at least. So if you go to clinic and your baby has gained 100 grams, that's a problem. Okay? That's one. Two, is your baby peeing? You know, a baby, when they're peeing, how many times are they peeing? We expect them to pee at least 6 times in a day. I know you will not really be able to tell in this diaper session, but look at the diaper. Is the pee they're peeing concentrated? How much pee is it? If your baby is spending a whole day with a dry diaper, there's an issue. Your baby is not breastfeeding enough. Again, remember things that like pacifiers. You know, we are cool young people and we want to put things in baby's mouth so that they can keep quiet.
Yeah.
You know? But when Daktari talked about on-demand breastfeeding, on demand, every time you put a pacifier in the baby's mouth, you have taken away an opportunity to breastfeed. So you're wondering why the baby is not gaining weight. There's something that has taken the place of breast milk.
Okay.
Yes.
All right. I'll cut you short because I'm told we are out of time.
Oh my goodness.
Yeah, probably we need a whole session for this one, director, yeah, and producer. Okay. Sawa. Daktari, your last comments in closing.
I think when it comes to feeding children, it's good to think variety in every meal and in the course of the day and in the course of the week.
Variety.
Yeah.
Kristen.
Oh my goodness, I have so much to say. There's something I didn't say. Please, do not give your baby those flowers from a certain street that are omena mixed with beans, mixed with... Okay?
Yeah.
We tend to do that, and that does more harm than good. Part of the rickets that we are having and low calcium levels is contributed to by that. So don't do that. I think that's important to mention.
Okay.
As Daktari said, variety is key.
Okay.
Once you have that done, you've done it.
Variety. Thank you so much for coming.
Oh, thank you so much.
We
for having
appreciate
us.
your time.
Thank
We are
you.
out of time, but we sure will. Yeah. So many questions here. But thank you. Thank you so much for keeping us company on Hope TV. This is where you look and live. This has been Health Check with dietitian Christine and Daktari Wachira, who is a pediatrician. Thank you for your time once again. We look forward to another episode with you. I am Sharon Aitorre Wangenye. See you next time.